In fact, I've actually printed out your CVs. I've brought mine from when I was 15. I was passionate about getting a job in the food service industry, and my hobbies include making my own skirts. My name's Dr. Dawn Bowdish, and I'm a professor at the McMaster Immunology Center. But today, it's not really about me at all. It's about two truly exceptional young men who've made some amazing strides in lung research at a very young age. And I'm very, very pleased to present to you Avinash and Arjun Pandey.
So a few years ago, I had the opportunity to go to my dad's clinic for Take Your Kid to Work Day. And I met a patient there who was suffering from severe pulmonary hypertension. And her struggle and her story really inspired me to try and research pulmonary hypertension to try and help patients with it. So one of the studies I was doing was looking to see whether weight loss and dietary interventions can help to treat patients with pulmonary hypertension. And specifically, we were looking at a dietary intervention called the DASH diet, which is a diet that's rich in fruits, vegetables, fish, low-fat dairy products, and one that really emphasizes a low sodium intake. And what I found was that patients who adhered to the diet and who lost weight actually had an average of a 25% reduction in pulmonary pressures, which is considered to be very significant.
That's amazing.
It's really important to have a link between both the healthcare provider who is prescribing the medication and then the patient who has to take that medication. And I think that there's a lot of different ways that the system that I've developed can be implemented. One of the things that's so special about it is that it can send these very personalized text message reminders for free automatically, and so it doesn't require too much maintenance or anything like that. And it allows patients to be reminded to take their medications or to adhere to their exercise regimens, which, like you said, can be very complicated. And in addition to just reminding them, it can help to motivate them. It can provide them with the information they need to continue to adhere. And I'm looking into other fields beyond just medication adherence, exercise adherence, looking at maintaining blood pressure, looking at blood sugar, and all of these different fields can be so easily managed when you look at the technology that we have available to us today.
That's amazing. So I want you to be honest with me. Are you allowed to have a cell phone?
So like most of the people my age, I have a cell phone, and that's really where my ideas came from.
Well, I have to say that that's a message that resonates with me, and I'm so glad you boys are going into research careers, because as a basic scientist, I really feel like our job is to provide hope for people who are struggling and living with some of these very challenging conditions. And I'm so glad that you're going to be providing hope to so many of the people who are going to be affected by the lung diseases that we're discussing today.